Okay, awesome. So, hey, everybody, it is Black Maternal Health Week, and I'm so excited that we get the opportunity to talk to a certified nurse midwife about all of the things that we can begin to do to really arm ourselves and protect ourselves and have the positive maternity experience that we all so desperately want and absolutely deserve. So, I'm going to let our special guest introduce herself, tell you guys a little bit about her experience, her business, her mission, her passion, and then we'll get into some of the frequently asked questions that have been popping up this week. So, welcome to Desiree Blake. I'm so excited to have you here.
Thank you. I'm excited. I appreciate you for reaching out just to kind of talk about some of these issues. So, to give a little bit of backstory about myself, I am a certified nurse midwife, but I'm also a women's health nurse practitioner. I graduated in 2015 and have been actively working in that role. I started off as a labor and delivery nurse and then became a midwife. Once I became a midwife, I worked for a private practice from 2015 up until 2019 when I had my own child, which definitely changed my perspective of the care that I was giving. And although I was doing a great job before, it boosted everything that I was doing and made me appreciate labor and birth so much more.
Yeah.
I was working out there in Canton for a while, doing full scope, doing deliveries, seeing patients in the office, you name it, I was doing it. And then after I had my son, I transitioned into another role where I was only seeing patients in the office. And my goal is to get back into doing deliveries as well, or attending births, I should say. But I needed that because it prompted me to open up my own practice. I've always had this dream of doing it myself. And working for another company where I was only seeing patients in the office definitely pushed me to say, now is the time. I think that we definitely have to change the way that our health system is working right now. In my mind, I always say that it's kind of going off of a conveyor belt. When you have patients lined up, I don't think that patients really understand from their perspective that we're only getting 15 to 20 minutes with each patient. And it's very, very hard for us to understand your concerns and to come up with a plan where we're both working together to figure out what's the best next step for you. So now with my own private practice, I'm giving that all of my patients more time, more in a sense of each appointment is scheduled out for an hour. Whether we use that complete hour or not, that's completely up to you. It's whatever you need for that day. I don't want to just have it where you're coming in and I'm thinking, okay, well, I'm just going to schedule you for your next appointment because I'm just trying to make money off of these appointments and keep being able to bill insurance. Instead, I want to actually take care of your needs. So that's what I'm doing now, and I'm excited about it. It's actually going very well so far.
Yeah, I'm excited to have you. It's so great to have you, especially in Cleveland on the east side. It's so desperately needed. Since you have such an extensive background and now you're in private practice, but you were in like the hospital for a long time, I do want to ask because people will want to know what's the difference between like a doula and a midwife? Because everyone asks, okay, well, if I have a doula, do I need a midwife? And if I have a midwife and I'm getting all this extra care from my care provider, do I need a doula? So, what's your perspective on that?
I think there's room for both, honestly. So I've worked with some amazing doulas when I was doing full scope midwifery and I was attending births. And there were some times where it's like, hey, as your midwife, I just needed a break for a second, or I was managing more than one patient in that time. And definitely doulas are awesome because they can be there to support you and give you some of that one-on-one care that sometimes your midwife is not able to do all of the time. So I always think of it as a doula is their main job is to support you in any way that you need during that pregnancy, but also during that labor. For a midwife, we have a different outlook on it. Yes, we are going to be very supportive. I'm one of those people who I'm in the room with you the entire time. I'm coaching you, whether you need a back rub, a foot massage, you need to get in the shower, whatever it is, like I'm going to support you. But I'm also looking at it from a different light as well, because now I have this medical background on what's all happening during your labor course. So I'm paying attention to mom and baby. So I always think of it as most people who are in the labor and delivery room, they're looking at what they can physically see. They can see a mom, they can see that she's uncomfortable. From a midwife perspective, I'm thinking about this baby that's inside that everyone cannot see, that they're not really paying attention to what's going on the monitor, or if we need you to be on the monitor. They don't know all of your risk factors sometimes and what could be a potential threat during labor. Midwives are thinking about all of those things and thinking about how we're going to get mom and baby through this birth process the smoothest way possible. So I think there's room for both. I think that when someone has a midwife, there's not a bad thing of them having a doula as well, because they can tag team on that support side, and also help and support dads or whoever else is in the room with them. And it allows for the midwife sometimes to kind of take a step back if she needs a break, or if the doula needs a break, the doula can take a step back because that midwife can also be there to support them as well.
Love that answer. Okay, so now that we know the difference, let's talk a little bit about people who are not yet pregnant, but they are thinking about like growing their family. A lot of people want to know, like, if they are planning and they want to get started on their family in the next like 1 to 3 years, what are some of the things that they should be doing right now in order to prepare for like a positive maternity experience? And what are your thoughts on that?
So I think that majority of births are not planned. So the moment that I hear someone saying, "Hey, I'm thinking about doing this," that makes me excited. So the first thing that I all the time tell people is schedule an appointment with your primary care provider. Number one, you want to identify any potential risk factors that could become any issue during the pregnancy. So whether or not you know it, could you be obese for pregnancy? We look at a BMI that's over 30, and we say, okay, this is obesity during pregnancy, and it can cause potential threats to the pregnancy. Or you could have different outcomes in the pregnancy based off of obesity. We also look at blood pressure. Okay, are you hypertensive? What do we need to do to try to get your blood pressure down before you get pregnant? Or any other type of risk factor that you're having. You could have ongoing chronic conditions. You want to know how those things can affect your pregnancy and what we can do prior to pregnancy and during pregnancy so that you can have a healthy outcome. A lot of times people just show up after they're already pregnant, and they could have potentially been on different medications that were not safe during the first trimester. So it's nice for us to know, hey, I'm thinking about being pregnant. Let's transition some of those medications to medications that are safe during pregnancy. Or let's go ahead and start prenatal vitamins prior to pregnancy, because we know that when you initiate folic acid, that helps to decrease spina bifida as well for women. So starting your prenatal vitamins, it should actually be before you got pregnant, because the spine is one of the first things that starts to develop. Not, okay, now I'm pregnant and now let me start taking the prenatal vitamin. It's great then, but it could have really helped you if you were on it prior to pregnancy. So I would tell people the first thing you want to do is identify any risk factors. Schedule an appointment with whoever your provider is. Hopefully, it can be a midwife, but schedule your appointment and let's talk about risk factors. Let's talk about what happened in previous pregnancies. Could that be something that pops up again in your next pregnancy? Or do we need to do special testing, to look out for different things? Or is everything fine and you just get the green thumb and you're just like, okay, whenever you're ready, let's have a baby?
Love it. I didn't even think about taking the prenatal vitamins before you even started, like to think about starting your family. That's such a great tip. Okay, so let's talk about for people who are already in their first trimester, right? So people who are generally like first trimester for just everybody watching is usually like 1 to about like week 12 or 13 is usually how they classify the first trimester. So a lot of times like people are just finding out that they are expecting and immediately they have their healthcare provider and then they want to call a doula in the first trimester because they are so afraid about like the numbers and what they can do in order to have a positive maternity experience and stack the deck in their favor. So what would you say to people who are in their first trimester to sort of like ease their stress and anxiety and really begin to have a positive, strong foundation from the very beginning if they are already pregnant?
So the first thing when I hear you ask that question is it kind of breaks my heart a little bit, because the way that I approach pregnancy, when someone comes in for that first visit, that should be a moment where your provider is doing a lot of education. So that first appointment should be them identifying what are your risk factors and talking to you about the different things that are going to occur during pregnancy to kind of decrease some of the risk as you go through the pregnancy. So when someone says like, "Oh, I need to call whoever," if they need to do a consultation with someone, if they need to call their doula because they're worried about the numbers, that lets me know that their provider really didn't do a good job at that first visit, because most people are afraid of what they're hearing once they leave that appointment. I think that it's unfortunate, but a lot of women share their horrible birth experiences instead of women sharing more of like the positive things. So of course we're going to hear that, and immediately we go into panic mode. Even as a provider, I'm not going to lie. When I found out that I was pregnant, the first thing that I started thinking about is, what about this? What if this happens? What if this happens? Like, we go into panic mode because we're like mama bear all of a sudden. We have to protect our babies. We want to make sure that we're here to care for our babies at the end of this pregnancy as well. So I remember for myself, I had to stop, like take a deep breath. And I remember having a conversation with my own midwife, and I said, okay, so these are the things that I'm really worried about. And let's just like unpack, am I at risk for any of these things? And it was just like, okay, not at risk for that, not at risk for that. So why am I consuming myself with it? So let go, enjoy your pregnancy. Now, if things start to change, if you're becoming symptomatic, if you have a first degree relative who went through something, tell your provider, hey, this is what I'm afraid of. Like, can we talk about this? Are there ways for me to prevent this? Because they should be walking you through that. They should be holding your hand. I look at pregnancy for anybody. I can honestly say anybody who has been a patient of mine, I tell them, hey, we're becoming family. Like, at the end of the day, the way that you're going to go through this pregnancy is you're going to have somebody who's there to coach you through. You can call me at any point. We're family at this point. Like, you're growing your family. Well, I'm an addition to your family. And whatever questions you have, whatever fears or concerns that you have, talk to me about them. We can figure out if that's a valid concern right now, because sometimes you just need to know, like, hey, that's not even an issue. Like, stop even thinking about it. Like, you're not in this category of people who normally experience this. Or yes, you are, but this is what I'm thinking that we're going to do moving forward. Because sometimes I think that patients won't really understand that yes, you are at risk, and this is what your provider is doing to help with that risk. Instead, they're just like, well, they just told me I needed to do this and I don't know why. But it's like, okay, well, let's link the two together. Let's have like an actual conversation and link the two together so that the patient finds some rest and reassurance in what's going on. And then you as a provider will also get compliance from your patient because they understand the importance of it.
Love that, especially thinking through like how much mindset plays a part in the journey as well. I think too, people always think about like medical, like safety, like, you know, physically, but it's also a spiritual experience. And it's also one where you do have to have a mindset too about what you want to experience. Let's talk about questions that you should ask your provider. So the person who is doing like your well care may not be the person who you want for the person who is delivering your baby, right? You may want to evaluate if that's a good fit and if you guys are aligned in like your vision and your goals for like labor and maternity throughout. So if people do want to ask questions just to make sure that they are on the same page with their provider, do you think it's any sort of questions that would really help to reveal that to them?
Absolutely. So it kind of depends on what direction someone wants to go in for their pregnancy. Some people are like very laid back and they're just like, hey, like, I don't even care. Whatever happens kind of happens during labor. And then there are other people who want to be a little bit more involved or want to know a little bit more about their provider and their experience. So I think that scheduling a consultation, definitely, if someone is thinking about pregnancy, or it can even be during one of your well care visits where you go in and you just bring it up. Hey, I'm considering being pregnant. If you are someone who cares for people during pregnancy, what are your thoughts on whatever it is? What are your thoughts on interventions during pregnancy? Like, are there certain things that you automatically do during each pregnancy? Do you have any wiggle room during that? Or is it just cookie cutter that you're treating every single patient the exact same way, which I totally disagree with, but that's just me. I feel like you want more individualized care. So asking your provider, like, do you provide individualized care versus, do you have policies that are very, very strict that you do for every single patient? Asking them also about, if someone risk out, let's say someone has very, very high risk factors for certain things, are they comfortable with caring for those things? Because the last thing that you want to do is to have someone who is practicing with outside of their scope and just not wanting to transfer you just because they want to keep you within their practice, because this is how they're making money. You want to ask them about collaboration. Let's say that you're dealing with a midwife who So for midwives, there are certain things that we don't care for that are high risk. But let's say you're very, very comfortable with that provider and you want them to care for you. But if risk factors start to come up, you want to know, like, what will they do? Will they just completely transfer you over? Or are they comfortable with collaborating with a physician so that you can still get the care that you desire, but at the same time, making sure that someone has those medical eyes that are looking in to make sure that we're doing things properly? The other things is thinking about your labor experience. What things are very important to you? If you know that ahead of time and you can discuss that with your provider, whether it be at your first visit or if you're already 36, 35, 36 weeks, will they be able to listen to you and to talk you through some of those desires that you want? And if it's something that you are not, what's the word that I'm looking for? If it's something that you can't do during labor, will they explain to you why can't you do this during labor, or why can't you have this during your birth? And if it's a flat no, what other alternatives do we have? So how flexible is your provider in trying to meet your needs? So not that we want to be controlling during pregnancy, everyone wants to be flexible, but we can't all the time think of the patient as just having to be flexible. The provider has to be flexible as well too.
Yeah, for sure. And speaking of that, I know too that it's not always just the provider that you have to take into account. It's also the place that you are deciding to birth as well. So, do you have any advice for people as far as like how they can find out like what are the policies and standard procedures that happen at maybe like the hospital or birth center that they choose to deliver?
Yes. So, wherever you're considering to have your baby, whether it be at one of the major hospitals or if it's, one of the smaller hospitals, you can go and take a tour. So, if you sign up for any type of childbirth education classes during pregnancy or prior to pregnancy, they can take you on a tour. There can be someone who will give you insight as to how things are ran within that unit. But also, your provider should be talking to you about that as well because they have hands on experience on what's happening with their births when they go in to attend a birth. They can tell you like, okay, it's very strict on this, it's very strict on this, or this is how anesthesia likes it. I think of the first thing that I just thought about was when patients go into the hospital and they're like, hey, I don't want to have an epidural, I want to be able to like eat a little bit during labor. And you have some hospitals who anesthesia is just like, absolutely not, that's not happening, like you cannot eat. We don't know if this is going to turn into a C-section, so none of our labor patients are going to be able to eat. Well, you want to know that about that hospital. The other thing that I always tell people, this is one time where I do say, like, hey, talk to some of your family members, talk to your friends, find out about their birth experience because they can give you firsthand insight as to what's going to be happening, what things were offered to them, what things were not offered to them as well. But I take it back to the providers. When you're talking to your provider, they can give you a lot more insight as far as like what things are must haves for you, and can we actually implement that at the hospital of your choice.
Love that. Okay, so another question, but this is more so if you're already in labor and you're at the birthing facility, right? So sometimes when you are in labor, there could be things that are going on that are not going according to plan, and you could feel like you're asking questions, but you're not getting the answers that you really want. Sometimes, like doctors don't fully explain all the risk, or they say that there's no risk at all, right? So are there like questions that people can ask in order to take a deeper dive in those moments so they can make the best decision for themselves and for their families and get the information that they really need?
So, anytime that any type of intervention is happening during labor, a patient, you have the right to number one, say no. Um, and if it is not posing a threat, your decision is not posing a threat at all, then they have to honor that. Do not, it's That's such a bad thing, but do not feel the pressure of providers to have it go a certain way if you feel as if that's not what's in your best interest. And if you're in that situation and you feel like you are being pressured, the first person who I would say talk to your nurse. The nurse is right there. Tell them your concerns. That nurse can now um, be your advocate. They can go back and they can talk to the provider and they can say, hey, this is what's going on. This is how she's feeling about this. Because when you think about it, a lot of times people are in labor and not all the time they know their provider who's actually there to attend their birth. A lot of times they've spent a lot of time with their prenatal appointments with one provider, and then they get to the hospital and they have a different provider who they don't know. So why would they trust them? So when you get there, you have a labor and delivery nurse who you're going to spend probably 12 hours with. So you're building a relationship with that person. So you learn to trust that person as that shift is going on. So if you have concern, know that she can work in your favor, and she can go and she can talk to that provider and let them know, like, hey, she's just not comfortable with this. The other person who you can talk to is one of your family members. Sometimes when you're in labor, you're uncomfortable. You're not seeing the big picture of what's going on, but that family member who's sitting there, they are seeing everything that's going on. They can now go and talk to either the nurse, or they can pull the provider to the side and say, hey, can you explain this a little bit to me? Because that's the goal, is for everyone to be working together as a team to get the outcome that we all want. Healthy mom, healthy baby. That's what we want at the end of the day. So your advocates when you're in labor, number one, yes, you can advocate for yourself, but that's very hard to do when you're uncomfortable. But then your nurse can also be an advocate for you. Your family member, whoever your support person is, your doula, they can be an advocate for you. But then that provider, hopefully your provider who's in the room, they can also be an advocate for you if there's things that are going on, whether anesthesia or your nurse is not doing different things for you. You can talk to your provider as well. And if it has to be what they're actually trying to enforce, then that needs to be explained to you as to why are we doing it that way. If it's not emergent, they have time to talk about it.
And since we're talking about advocates who can come to someone's aid, let's talk about the role of like a patient advocate in the hospital, because I used to be like a nursing assistant. And I remember when I used to walk through the Cleveland Clinic, I used to walk right past the patient advocate's office, and it was like third shift. So the office was like always closed, and it was like open, like when I would leave at 7 o'clock in the morning. But like, I never really understood like what is the role of a patient advocate, and is that someone who could be an ally to Black moms as they are birthing in the hospital if things are not going according to plan, or they do feel like they are voiceless in their maternity care.
You want to know something crazy? I called them. I called them when I was in labor. Well, I called them not when I was in labor, but after I was discharged from the hospital. So,
Mm.
backstory. I go into labor, and I'm not going to mention the name of the hospital, but I chose to have my friend who is an awesome midwife. I wanted her to be there for my birth. But I didn't think
Okay.
that I was really in labor when I got to the hospital. I was 34 weeks and 6 days. So I'm like, oh, I'm preterm. The midwife didn't even know she was in labor. That's how like,
Mm.
just go with the flow. Like, you'll know when you know. So I get to the hospital, had not called and told her that I was in labor. So there was a physician who I'd never met a day in my life, did not know her from a can of paint. So she comes in, never says hello to me, never like introduced herself, nothing at all. She just put on her gloves, sat on the edge of the bed, getting ready to do my cervical exam. Now, I didn't think that I was in labor because I was not in any ounce of pain, no discomfort. It was actually my fiance who had told me, like, hey, I think, are you contracting or something? Because you keep squeezing my arm a little bit. And I was just like, no. And then I paid attention to my stomach. I was like, oh man, my stomach is tightening up. So he actually encouraged me to come to the hospital. When we got there, I saw that I was contracting like every 2 to 3 minutes. So now here comes the physician into the room. Like I said, never said one word to me. Then she does my cervical exam. And when I tell you, I cried from my exam, like I'm screaming, I'm scurrying up the bed, like I was like completely uncomfortable. I do exams every single day. I've never hurt someone. I've never made them cry during the exam. And if I did, number one, I'm going to pause in the middle of that exam and I'm going to say, hey, are you okay? I'm going to explain. Can you relax your bottom? This doesn't have to be that uncomfortable. Let me like readjust something. Or even afterwards, I'm going to say, hey, I'm very, very sorry that you experienced that type of discomfort. She didn't say anything. She got up, she walked out of the room, never told me my cervical exam, nothing at all. I immediately called my midwife. I'm like, hey, I don't know what's going on. I'm at the hospital and I'm thinking, sorry, I'm just going to call a spade a spade. I'm thinking because I was in this suburban hospital and here I am, I look young and I'm Black, that she probably pegged me as just a random Black girl who's young who got pregnant. And you shouldn't treat anybody that way. But hey, guess what? I'm not. I'm a certified nurse midwife. I know what should be going on when you're coming in doing the exam. And this is completely uncalled for. And you didn't even have the respect or decency to apologize. So when I called my midwife and I'm telling her what happened, she immediately calls that physician. Come to find out, I'm 4 centimeters dilated and I'm preterm. So she said, I'm on my way into the hospital. Granted, everything from that moment forward went fine, but it made me stop and think after I left the hospital. And it kind of, I warred with it for maybe about a week. And I said, something has to be done about her because there's so many women who have no idea what to expect. And she's going to treat every single one of them the exact same way. And it's not called for. So I'm glad that I was there. I'm glad that she did that to me. And I immediately called. They ended up pulling her in front of the board and they discussed her actions and put her on probation for it. And I think to myself, if I wouldn't have went and called and told them about my experience, and if I was not a midwife, which I shouldn't have had to be a midwife in order for them to do anything, but if I wasn't a midwife, they wouldn't have taken it as serious. So I'm glad that I was. So absolutely, if something is happening, you call them, you let them know, and if it's something valid, they are going to address it. If it's something that they're like, I don't really know if this is a concern, they'll tell you that as well. Because I asked, all right, I said, do you think, I told the lady, I said, I don't know if I'm just in the emotions of me having a baby. I was like, but do you think this is valid, what I'm telling you right now? She was like, absolutely. And we have to do something about it. So I would say you have to call. That's what they're there for. If you're not calling, you're not utilizing them and they have no idea what's going on.
Okay, so patient advocate can be an ally, so definitely get that information and reach out to them. Okay, awesome. I feel like you dropped so many amazing gems and given so much information that people can really use in order to have a positive maternity experience. Is there anything else that you want to share with everybody or anything you wish you knew going around becoming a first-time mom that you want to share with everybody else?
The only thing that I would add additionally is if you are receiving care and you feel as if maybe something's just not right, you can always do a consult with someone else too. So I do these all the time. I've actually had a few patients who are being seen somewhere else and they call me and we do a virtual consult, or they come in office, I request their records and we walk through what's been going on with their pregnancy. And sometimes it's just the education that's taking place or the lack thereof. For instance, I had a patient who came in and she said she didn't understand why she was high risk and they were telling her to do all of these things. And when she came and we walked through, hey, this is being done because you have the increased risk for this, and we're trying to protect you from this. And she was just like, oh, well, they never told me that. So I would say you don't necessarily have to transfer care unless you feel compelled to transfer care, but you can definitely ask for a consultation to know a little bit more about what's going on. And I would say make sure that you pick a provider that you actually feel you can trust and that they will educate you. And I think that's what's lacking right now. I think that like I said before, a lot of people are practicing in this hospital model and they don't have the time to educate patients. So a lot of patients feel like they're just being strung along and they don't understand the significance of things. And we can't, as providers, we cannot continue to label patients as being non-compliant if we're not taking the time to educate them on why things should be done a certain way. But also we have to stop medicalizing birth so much that we're looking for things to be wrong. And if something's not wrong, then sometimes I feel like we're creating problems within healthcare as well. So
Mhm.
I would say find you a provider who you feel like you can trust and find a provider who will educate you the most. So,
Yeah, I love that. Thank you, thank you, thank you so much. I really appreciate that. Tell everybody where they can find you and follow you. And if they are in Cleveland, Ohio, sorry, y'all, how they can get you to be like their provider and reach out for a virtual if they're already seeing someone and thinking about switching.
yeah, well, first of all, I want to thank you. Thank you for reaching out and, conducting
Yeah,
this interview. I'm very, very happy and I hope that we can work together in the future.
absolutely.
Yeah, and if anyone does want to reach out and have a conversation with me, schedule an appointment, my website is beautifulbeginningsandbeyondmidwifery.com. I'm on Instagram as BBB underscore midwifery. And then also on Facebook the same way. I had to make sure that that was right. The same way, BBB_midwifery. You can also reach out to me via phone. My number is 216-258-0841.
Okay. And no worries if anybody is like scrambling trying to find a pin. I'll make sure to put that in the description of wherever you're watching this video or listening to the audio. So you have a job now. If you are not expecting and you just listen to this whole thing, you are obligated now to send this to someone who is, so that way they can have the best experience possible. And if you are, now you have information that you can use in order to have a positive maternity experience. I want you guys to know that no matter what color you are, it is possible to have a positive maternity experience in despite the stats. I don't want you guys to be afraid. I just want you guys to have knowledge and have power and have options, so you know how you can make the best decisions for you and your family. So thank you guys so much, and thank you again to our special guest. I so appreciate you, and we will see you guys in the next one. Bye. Oh wait, let me